So, Dr. Wally Wang, a doctor in China, medical doctor in China, found out that as a result of COVID 19, the situation in caregiving has become more stressful. There are some lessons that we have learned from the Chinese regarding person with the dementia and caregiving. So, one of the first things is that they are not able to understand the situation. They are not able to comprehend why things changed so drastically for them. So the situation does show that the person um, can decline um, in memory and understanding as a result of that. In fact, the Chinese found out that the person can decline a little bit faster. So, what are some of the things that the Chinese found out that the quarantine has caused? So, the quarantine caused behavioral changes, sleep disturbances, boredom, and inability to respond positively to the situation or to respond to care. They're a little bit more anxious, they're a little bit more um, confused, a little bit more agitated, and they don't understand. But they're letting you know that there's something going on that they're aware of, but they can't explain it to you verbally. So, Dr. Wally Wang, a medical doctor in Wuhan, China, realized that the disease affected people with dementia and their caregivers in different ways. That, for example, it made caregiving a little bit more stressful. It created more anxiety, and with the both the caregiver and the care receiver, because now what would happen if somebody in the household gets infected, and the whole isolation issue. So again, COVID 19 made things more stressful. It brought more anxiety into the house. It created a situation where there is now a higher level of care, because the caregiver doesn't want the care receiver or the person with dementia to get sick. Um, Among other things, emotionally, it affected people with a certain level of anger. So now they're angry that they're isolated, they're angry that they're at home. Um, and obviously, a person with advanced dementia cannot verbalize that, but there are ways that they can tell you how they're feeling through their behavior. You just have to pay attention to that. Also, there is more conflict with the caregiver. So the caregiver, because of the level of stress now, has a little bit less patience and has a little bit more conflict with the day-to-day caregiving at home. And also, there's confusion and panic for both the caregiver and the care receiver. The care receiver doesn't know what's going on, and the caregiver is aware of what's going on outside and is at home trying to protect the person with dementia from becoming infected. In some cases, caregivers began to deal with a higher level of stress, a higher level of anxiety, a lot of anger, and more concerned with the person with dementia, because now they're at home isolated. So, how do you manage the day to day, but also how do you um, reduce the risk of possible infection, right? So, some families were affected differently, but it's important to recognize that you might get affected, or you may be affected by some of the same things that people who are caregivers in China are affected by. So the lesson from China is that in some families, in some cases, COVID 19 increased the level of anxiety, the level of stress, level of emotions, specifically anger, on both the caregiver and the care receiver, and also a little bit more confusion on the part of the person receiving care. So let's talk a little bit about how the Chinese were able to manage and deal with those problems. So they created a situation where there was emotional assistance for the caregiver. Now, we have that here with different agencies and organizations that provide that service for you. And they are in operation 24 hours a day, 365 days a week. They also found out that in some cases, they needed physical attention. So they actually needed a secondary caregiver or an alternate caregiver to come into the house and relieve the primary caregiver of their duties, at least for a couple of hours, so that they could do something without leaving the household. So if you are having somebody, an alternate caregiver, to come in and assist you with the care, then remember, social distancing is very important. Wearing the mask and washing their hands. So as long as all those rules of precaution are observed, you'll be okay. Also, looking for things to keep the person with dementia occupied, whether it is painting, drawing, anything that is within the skill set and skill level that they can still manage, because you want to avoid frustration by giving them something that is too hard for them to do, but giving them physical things that they can actually assist with or do, assisting you in the kitchen, maybe with the cleaning, maybe with folding clothes, things like that that keep them physically occupied. Be aware of physical discomfort. They're trying to tell you something. They may not be able to address it verbally, but they are always trying to communicate with you in nonverbal ways. So you have to be aware of the cues that they will give you through the behavior, so that you can understand what it is that they're trying to tell you. And also so that you're available to manage the emotional needs of the person. They may not be able to tell you, I'm tired, I'm bored, I'm hungry, but through their behavior, they will be able to let you know and make it easy for you. It's important to be sensitive to your own needs. Remember, as a caregiver, you come first. If you're not well, if you're not taking care of yourself, then how can you possibly take care of somebody who needs you? So you need you, and the other person needs you. So you have to make sure that you're available emotionally, that you're available physically, and that you can provide the quality of care to which the person is accustomed to. The needs of the person with the condition has increased because of the quarantine. Now, because it completely disrupted your life, it completely disrupted the life of the person with the condition. So you have to figure out how to stay ahead of the disease and manage some of those behaviors, some of the aggression, some of the confusion, some of the behaviors that come as a result of being at home 24/7. So it is important that you keep yourself safe, secure, and also reassured that you're doing the best that you can. By the same token, now you have to keep the person with dementia safe, secure, protected, and reassured, because things have changed for them and they cannot make heads out of tails. They cannot understand why now they're homebound and they can't do certain things that they're used to doing. In the meantime, be good to yourself and be good to the person you're providing care for. And remember, you're doing the best that you can.